Willie Long Street from Los Angeles, California. I'm 56 years old. Yeah, I'm the assistant pastor at the 88th Street Temple Church of God in Christ. When I first realized I had an issue with my health, I was at work and I started having shortness of breath and I could barely move. And as I walked, I would feel dizzy. I couldn't even go up a flight of steps. I couldn't lift nothing. Very difficult for me to move around and do my daily activities. Just to walk 20 feet, I would just be so drained, just lethargic. I couldn't even sleep. And I would wake up in the middle of the night like somebody poured a bucket of water on me. And I would wake up gasping for air. Sometimes 3 to 4 times a night. And I started sleeping sitting up like this. And the sharp pains, it would get, first it would be for like a minute, then it constantly continued to increase. It's just real sharp. And it got so painful, it hurt to lift my right arm. And I was like, oh, let me go in. When they started doing tests on me, they're like, no, it's not trapped gas. You got congestive heart failure. You got a irregular beat to your heart. You're too stressed out. What you stressed out about? And at that time, I was taking care of my wife. She had 3 strokes, and open heart surgery. My blood pressure was like 170 over 110. They like, woo. And they admitted me in the hospital. It was some multi-symptoms that I had that just then with the diabetes and then with the hypertension, then I had this shortness of breath. And it was hard for me to breathe. So they had me on oxygen. Then they put me on the CPAP. The CPAP is the breathing machine, because what happened, my breathing would stop for a whole 3 to 4 minutes. So I was really in bad shape. I was in the hospital every year for a week, first of the year, from 2002 up to now. What they was doing while I was in the hospital, the heart specialist came in and looked. He said, I want to do a test on you, what they call a stress test. During the stress test, I passed out. I went into cardiac arrest, and they stopped, they revived me, and then he came to the room and told me, he said, you got some blockages, my pressure will go up. And they like, he's in the stroke level. This is stroke danger. And what happened, I just passed out, and they just kept trying to revive me. Couldn't say nothing. They had to lift me up themselves and put me on the gurney and push me back to emergency. They kept me for a week. I just kept saying there's something that I can do about these symptoms, because all the medicine was doing was just like a quick fix. It wasn't resolving nothing, because you giving me one pill, but it's creating 10 other problems. I'm like, I don't need no more problems. Every time I go to him, he's still adding more medicine. I want you to try this. I want you to try this. I came in here just for shortness of breath. And I said, you have not fixed my shortness of breath. Matter of fact, it didn't increase. So it was just more pills that they kept giving me. And they got mad. I said, when 2014 came in, I said, your word for this year is preventive. I said, when you can prevent something from happening, then we can talk. And then I told them I found this place I wanted to go to. And they said, what's the name of Global Cardio? I said, it's preventive. I said, what you got to lose? I said, I want to live. I don't want to die. First time I went to Global Cardio Care, my wife had her 3 strokes, and she was paralyzed on the right side, and it really worked for my wife because she was enjoying it. She was starting to get all the activity of her limbs back. Where they said she wouldn't walk, where they said she wouldn't talk, she was doing all those things and doing really good. I immediately started the treatment for me and my wife. And your people here at Global Cardiac, techs here at Global Cardiac Care was so helpful and so kind to me and my wife, and my life started changing right then for the better. Before 3 weeks was up, I had to go see my doctor the second week. He's like, "What are you doing?" I said, "Why?" He said, "Whatever you're doing, keep doing, because your heart is resting. You're losing fluid and you're losing weight." He said, "Your hypertension is down." And he said, "I'm going to have to take you off of these 3 medicines." I mean, that was just in 2 weeks. He said, "Well, I may have to send all my patients over to Global." Now he's saying, "I'm going to have to come to Global myself." He said, "I'm hearing more and more about Global Cardiac Care." He said, "I'm on this board of doctors at Cedars-Sinai, and some of the doctors said, no, that's a good place for your patients to go." Now, that's what my doctor said to me. And I went in just last week. They was looking at me like, "Boy, you done really slimmed down. Let me check your legs. Wow, you really keeping the swelling down." She said, "You still go to Global?" I said, "Yes, I do." She said, "That really works, huh?" And went from 17 different pills of medicine that I was taking down to about 9 that I'm taking, and on my way to get off of those 9. The main thing, I did not get surgery. To this day, I have not had surgery. I don't have the chest pain. I don't have the shortness of breath. I don't have the hypotension. I get up every morning. I have renewed strength. My energy level has shot out of the roof. My life is completely turned around. If you follow Sarah's program, I guarantee you'll be a better person, have a better life, and most of all, you'll have better health. That's all anybody have to do. Just follow the program. It's changing people's lives. I want to give special thanks to Sarah and her program, Health for Life. God giving her the intervention, the wisdom, the knowledge, and the know-how to put this together. And I'm living proof that Global Cardiac Care works, and it makes a difference. It saved my life. It's no fun not having health. It's better than any riches that you can obtain, having perfect health. Because when you got health, you got wealth. You can get wealth, and then you have to spend your wealth to try to maintain your health. And Global Cardiac Care is your key to health and wellness.